Dr. Carrie here. Welcome to Vet Ranch Roundup. Thank you for joining us this week. A couple things. One, I know we had talked about potentially losing Solo. We did. I am not really surprised about that, but I am super bummed. The good news is the other kittens so far seem to be doing okay and still eating. And then we have this little girl here, Clarissa, so we can fit that cute little brace on her this week. And then we just need to continue care with all those kittens and work on getting everybody adopted. So let's just get this week kicked off. I know, hon. He says my foot still doesn't work. It has a callus on it, so I know it is been like that for quite a while, and I don't think it's gonna get any better. So once we get him over this skin infection, I think he'll be better off without that thing, because it's gonna just continue to create a sore. Are you so handsome? Huh? Kitty kitty? He's so precious. It makes me so sad how he tries to play with that little paw. Buddy. We got the results back for Maserati. We went ahead and swabbed him and sent that out. And just as I had suspected, positive for feline herpes, which explains why he went down so quickly. And while we're also losing other kittens from the shelter, they're having a definite outbreak. So hopefully starting the antiviral medication for the other kiddos is gonna have a better effect.
Cute little prosthetic made just for Clarissa. Losing my patience here, folks. You gotta get used to this because your mommy's gonna do this at home a lot. Hey, sneaker pants. Come on, come on, come on, come on. Hey, stand up, stand up. What's on your legs? It's the worst. Clarissa. Come here, baby. Come here, silly. What's on your leg? What's this thing? What's this thing? What is it?
Yep, we're getting a toy that we think Wendy said this one's a hot ticket item. Hot ticket. Hot ticket. Does the crinkle too much? That's the question. Oh, I just realized she looks like a little Cleo. Like kind of like me. I don't know. I'm irritated. Look at Cleo right now. She probably looks just like that. I don't know. But anyways, here's Cricket's neck. Look how good it looks. Ooh, it's almost healed up. You look so good. Yes. Well, guess what? I said I am not taking any more cats or any cases right now because we've got to get some adoptions going, and we have tons of cats. But then a client said that he was going to take his kitten to the shelter because he lifted up his shirt and he had ringworm everywhere, and they had just gotten this kitten. His kids have ringworm in their hair, his wife has ringworm, his dogs have ringworm, so he's just kind of at his wits end. And I said that we will take the kitty because we don't want her to go to the shelter because they're full right now, and she'd probably get euthanized being as sick as she is. So I'll introduce you to Meeps, and before I even touch her or get her out, I'm gonna get gowned up, and then we're gonna start antifungal therapy and then give her a dip. So she can be best good friends with a little Han over here since Solo passed away. They were meant to be bros, so he needs a new friend for sure. This is our grody kitty corner. Here's our crusty friend Meeps. She's probably 90% crusty scale right now. Not a happy girl. Beepies, we need to get I have Melody in here because we're going to get a little bit of blood on her. Because we do worry about leukemia and feline infectious peritonitis, especially when a kitten has such generalized ringworm like this, because we're thinking, oh gosh, is your immune system okay? What else could be going on? The other thing is that they saw a ton of worms in her stool, so that's something we have to consider. And then we're definitely going to use a topical on her that's also a treatment for mange, because there's nothing to say that it couldn't be all of the above. Just because it's one thing doesn't mean it's not something else too. So she's crying right now. So sad. The guy said that she was sleeping in bed with them. And that's how they all got. Good job, Meeks. Okay, time for the bad part. About 2 seconds ago I said I'm gonna take this cat this week because I need to, but that's it. And now I'm like, hey guys, meet Oso. He was found as a stray. I'm not sure of the story of if his face was already swollen or it became swollen, but we are assuming it's a snake bite because we're seeing a lot of snakes this year, a lot of snake bites since it kind of has been a weird year and now it's like really warmed up. But he is feeling terrible, so we are gonna go ahead and get him some pain meds, IV catheter, and then we're gonna give him some anti-venom too to help stop the effect of the venom that's coursing through him right now, we're assuming. So let's get started. All right, we are thawing out our anti-venom here in order to be ready in a couple minutes. So we're gonna get an IV catheter in this little guy. Come on, big guy. We need to think of a better name. Oh, look at that tail. And we've decided to call him Fergus, and he really likes his hydromorphone for pain. Ferg, come on, bud.
This is Fergus, about 18 hours after administering the anti-venom. Fergus's face looks slightly better. I would say significantly better. A little bit of an appetite this morning. Hey, buddy. I know. Don't play with snakes. But he's still receiving his fluids this morning, antibiotics for secondary infection, but just resting comfortably. Gosh, those eyes. Yeah, you're a good old boy. You're a good old boy. Let's see. We still have some nasty drainage. Okay. Fergus. Day 3 of Fergus. Gave him some flea medicine yesterday. You may be able to see some little flea droppings on the towel. Where the snake bit him, it has opened up pretty good. So we're gonna have to keep him on antibiotics and possibly sedate him to clean that out. But gosh, he's doing good. As you can tell, he scarfs his food down. Where's my... Fergus is here. We're gonna pull the catheter. This is day 2. He's eating like a champ, so we're switching him to oral antibiotics and pain medication. Doing well. He looks a little wide-eyed now, but that's okay. So he's doing really good. So we're gonna get that catheter. He never has a full bowl, so we always like to see that. And we can take a look at his open wound there. This is Fergus's parasite screen, and as you can see, those are all hookworms. Tons of hookworms on this guy, and so we will treat him appropriately, but this is certainly not uncommon for a pup of his nature living kind of on his own for a while.
So this is Kiki and Squeaky's little hidey place in my office, like in the corner. But they are starting to come out a little bit for attention, and really coming out of their shell. Cute kitties. Kiki, Squeaky. Kitty, kitty, kitties. Well, my little Gumbo Man is going to a foster home. Not an adopter yet, but a foster, but we're gonna miss him. We checked on little Winzo this morning and noticed that there was a bunch of drool, that she had a bunch of drool. And then we realized it was all coming from her mouth. And she has a ton of gingival inflammation. Oh, I know. So most likely she has broken with calicivirus, which is not uncommon in stray little kitties, but her breath smells terrible and she's having trouble eating. So I'm gonna take her home with me because it's also very contagious and we don't want her around any of the other kittens here. So we're gonna take her home for a little TLC and give her some medication for pain and an antibiotic. Winzo. Poppy. Little better, huh? Mako. He is so happy now that he doesn't have that little leg hanging on, dragging that weight around.
Alright guys, welcome back to Vet Ranch. I'm Dr. Dave. This is my new buddy Casey. She was picked up by our local animal control officer, which is a theme you'll see happens a lot where we live. She was hit by a car, and she's obviously crazy sweet. She can't hold her liquor, as my dad says. And she's actually doing fairly good considering she's got a busted femur. She can walk on 3 legs. You can see this one's dangling pretty bad. You've seen this surgery before. I've done it many times before, but we're going to show it again. We can help her pretty easily, and as long as everything goes well, she'll be totally sound on that leg and go live a normal, happy, husky life. So we'll show you the surgery. It's going to be a cool one. It's actually one of my new favorites to do, just because the results can be so remarkable. We expect her to make a full recovery and go lick somebody else in the face. Here's Casey's x-ray. There's the top part, there's the bottom part, and we need to put them back together.
I've been through this before with us, so hopefully everything goes good. I'm actually going to let my associate help me a little bit because I've been doing a lot of these lately, and I don't need as much practice anymore on them, and she's only done a few, so I'm going to let her kind of take the lead, so you might be seeing a slightly smaller set of hands on this video. That's just her learning a little bit more.
Hey! Oh, that looks good. Day after surgery. Casey still can't hold her liquor. Tail wagger's working good. Leg looks good. A little swollen, but that's to be expected. It actually ended up being quite a bit harder than what I thought it was going to be. Not a great one for my associate to be practicing on, but we got it done. And she clearly is comfortable and doing good. So she's going to go... Oh, God. gonna go be fostered for a couple weeks and we'll recheck. Oh my god. That's too much. She'll be fostered for a couple weeks. Obviously, she's a great dog. We love her. They'll love her. Maybe they'll adopt her. So I'm happy. She's happy.
We are doing the second of 3 heartworm injections today, and then we're gonna do the next one in 24 hours. And she has 30 days of cage confinement, which is low activity. And that's it. All right, we're gonna give the second injection to Muffin on the other side. See, we did, I think the right side yesterday. Go this way. And this will be the last one. And then we can officially start her last stretch. Be tough girl. Be tough girl. You guys, this week, am I right? I wish you could talk back to me and be like, yeah, it was crazy, because I feel like you would if you could. I feel like every time I say, I was not expecting to get this dog, Fergus, and this cat with ringworm and all that, but it's true. However, I think we're starting to see a recurrent theme where I can't really say no, but it's all good, because look, these are our girls that we need to find a home for. Calamari and tartar sauce. So tell everybody, if when this video comes out, they still don't have homes, I don't want to adopt them, but I will if I have to. But thank you guys so much for watching our videos. If you are watching through Patreon, we welcome you as a new patron to our Vet Ranch family. Of course, we love our YouTubers as well and invite you, please subscribe if you believe in what we do. Hit that like button, it shows so much support. It allows us to still do what we do. So also, thank you to Abandoned Pet Project for funding all of this and sponsoring all the vet care. And also thank you so much to the people that donate, because without that, we would not be doing any of this. So thanks guys, and we'll see you next week. Bye. Wow.